Hi, this is Chris Smith with Local Joe's. At Local Joe's, we help local business. Hi, this is Chris Smith with Local Joe's.
This is City Pulse Newsmakers, a weekly look at the issues and the people behind them in Greater Lansing. Brought to you by City Pulse, Lansing's weekly alternative newspaper. And now, here's your host, City Pulse publisher, Burl Schwartz.
Good morning. Ingham County is suffering a surge in heroin and opiate overdoses. Police Chief Yankowski called it an epidemic, and he cited numbers. In 2013 in Lansing, there were 6 heroin overdoses, 1 fatality. In 2015, 236 overdoses, 26 fatalities. He spoke at a press conference attended by a number of public officials to call attention to this problem. 2 of them are with us today. Ingham County Health Officer Linda Vail, welcome.
Thank you.
And District Judge Donald Allen, who heads the sobriety court in Ingham County. Judge, welcome to the show.
Thank you so very much, Mr. Schwartz.
And here to help ask questions is Todd Haywood, who's been covering this issue for City Pulse.
Thank you.
All right. Well, these numbers are indeed shocking. And I think if we could spend maybe a little bit of time on Linda, on what is driving this increase?
Oh, wow. I think maybe if we actually knew the answer to that question, we might be able to get at stopping it a little bit better. You know, increasingly people have access to prescription narcotics. So a lot of it starts with access to prescription narcotics. Not to fault the medical community, but a lot of that has to do with prescribing habits around that, which you see a lot of states and a lot of communities in the basically getting at that prescribing habit issue as well. So that opioid addiction, pain narcotic addiction, frequently left out of control leads to a heroin addiction because it's a simple economic thing.
Well, what do you mean by that?
Well, apparently, an OxyContin on the street is going to run you, a pill, $40, $60, maybe $80, I don't know. Whereas a bindle, they call it, of heroin is going to be, 10, 20 maybe. So once you have an addiction to these opioids, your body physically craves them and needs them. And the economics of it frequently drives people to the heroin rather than the prescription drugs that they might be getting illegally, and it all just goes from there.
So would we be better off if we simply prescribed opioids for these people and kept them off the streets?
No, I don't think that is the solution. As a matter of fact, like I said, diminishing the prescribing is probably where we're headed. Somebody coming into to an ER for a broken arm or something like that, and having 90 days worth of Vicodin or something like that is just too much. It's not necessary.
So they get hooked on it,
right. Right.
Even though they're being treated legitimately, they get hooked on it that
So
way.
if you're continuing to prescribe it to keep people off of the street drugs, that would have to be, if you took that approach, that would have to be in concert with recovery and treatment.
Mm-hmm.
And indeed, recovery and treatment then uses drugs like Suboxone, which is got some opioid narcotic in it as well as some naloxone in it. So it acts then on the receptors in the brain in ways that help recovery or facilitates recovery and withdraw from the drug rather than continuing the narcotic painkillers, which is going to just continue an addiction.
Yeah, Judge Allen, you see the people who get arrested, you oversee the sobriety court. What are you finding is helpful to these people?
Really, the thing that I find that is helpful to the people is to try and get an understanding of what's actually going on with that individual, to find out if, in fact, they are a person that is actually actively using, and if they are, what it is that they're using and how often they're using it, and whether or not there are some interdictions that can occur that would help that person to be able to get away from what it is that they're using, if they're prepared to do that. One of the things about substance use disorders is that irrespective of the nature of the disorder that the person has, whether it's alcohol-based or other drugs-based, that if a person is not really seeing their use as a problem, then they probably have no shot at really actually being able to address the issue. If it's only a problem for the people that are around them, that love them and care about them, but it's not for the addict, then the addict is not going to be successful in going through treatment. And so when that person actually is motivated to change, that's what's going to be sort of the determining factor about whether or not that person's going to be successful. One of the things I think we need to talk about too is that addiction is a chronic relapsing disease. That even when a person is predisposed to wanting to get help, it's not necessarily a given that getting help is going to resolve the issue. Because as Ms. Vale was talking about, it's a disease, and it's a disease that affects the brain, and it affects the brain in a way that most people don't even really understand or can contemplate. And so it's really, it's about timing, it's about where you find that person at, it's about what it is that you have at your disposal, what do you have in your quiver that you can deal with, being able to bring to bear with regard to the problem. And it's baffling and confusing problem because addiction is just that nature, whether we're talking alcohol or other drugs. And when we're talking about opiates, we're talking about something that is even more pernicious than alcohol. It's a stronger addiction. And you just have to see what it is that you're dealing with and be in a position to do that. It's interesting because I've been doing this for a while. As a matter of fact, Ms. Vale and I actually know each other from our prior jobs. I used to be the director of the Office of Drug Control Policy, the state's drug czar. And so that's where I first became aware of this issue and Ms. Vale can talk to us about what was going on in her home community up in Portage. And Portage, Michigan, just in case you don't know, is a community very much like Okemos. Very affluent, not a problem with prescription drugs, not a problem with heroin. And I think over the course of 18 months, there were over 20 deaths.
There were, yes.
Of young people in high school. And so that was my initial exposure, was to be in that position as, drugs are, and to see how the problem sort of manifests itself. And then I was lucky enough to become a judge, and I preside over a sobriety court, as you indicated. And so, I've learned through this association, how to kind of navigate through the problem.
I think you cited, someone at the press conference cited the cost in dollars of nearly $374 billion a year, mostly for incarceration. What are we doing wrong?
Well, what we're doing wrong is we're not looking at the reason that the person's being arrested in the first instance. If you look at the reason that the person is being arrested in the first instance, then that will inform your decision making about what it is that you do with them. Because, for example, if we're talking about a person that has an opiate addiction and that person comes into the criminal justice system because they've been arrested, because maybe it was some petty crime or something that got them arrested, you bring them in, they get processed through the system. Maybe they're put on probation, maybe not. Maybe they just do some jail time, maybe not. And that case is closed. But if the underlying reason that the person came into the system in the first instance is not addressed, then it's just going to remanifest itself. As a matter of fact, let's say, for example, a person comes with a substance use disorder. Let's talk about it being heroin. Let's talk about the fact that the person comes in and their body is racked with pain as they're going through withdrawal from that drug while they're sitting in jail for a week or two. The only thing that that person is probably clinging to, if they're not actually in a position where they want to quit, is the notion that as soon as they get out, they're going to use. And they're going to use, and it's probably going to cost them their life, because they're probably going to try and use the same drug in the same amount that they use, not understanding that their body has detoxified and it's going to repress their ability to breathe, and they might die.
Yeah.
So a lot of people actually died when they get out of jail because they didn't really understand what it was that they were dealing with, and the people that were in the positions of authority around them didn't really understand what was happening with that person.
Todd?
Yeah, Linda, I wanted to ask you about the role of public health in this particular crisis, which is the word that you've used, the police chief used epidemic. I think they're sort of interchangeable in a basic way. But what role has public health played, and what role will it continue to play in addressing this problem?
Well, first of all, to start with, part of it was about understanding the scope and the magnitude of the problem. I had access to medical examiner information, so deaths. I easily have access to medical examiner information. The medical examiner's office is run out of my office. But, very quickly talking to people, it's like, we can't just measure this problem by deaths. There's, 50 opioid-related deaths a year this year, and about the same last year in the county. Because there's a lot of overdosing, there's a lot of abusing, there's a lot of near-death experiences happening that never get to that point. And unless we can start to kind of quantify and understand that. So back to your public health question, we've got some ability to collect data, information about what's going on with people in a public health environment because of a noted crisis or a reason that we need that data. So we are kind of that entity that's able to safely collect data from EMS, from the police departments, from the hospitals, because that's what we do, for instance, in a communicable disease outbreak. We collect information related to patients and we go out and we control the outbreak. So it's very much like controlling an outbreak in a way. You've got to have the data to do that. Beyond that, public health is very much about prevention. We're not going to be adding, drug treatment programs into the services that we have. But we do need to educate the community about what's going on. So the public health, one is the convening, the data collecting, and then this public awareness campaign so that we can start to help people understand that this is not a problem that's going on somewhere else to someone else. It may be your next door neighbor. It could be your son. It could be your aunt. It could be your father. It could be anyone, because it really is an issue that cuts across all income levels, all education levels, all races and ethnicities. It is an issue that's destroying, the fabric of our society, and every thread in that fabric of our society is potentially affected by it, not just certain people.
Linda, why, though, is this happening now? I mean, 2 years ago, the numbers were far less. Is it because we're being flooded with cheap heroin? Or why this surge now?
I think that's precisely the case. I know that you asked Ms. Bell the question.
Fine.
But yeah, I think that that's precisely the case, because I don't know if you know this, but the United States and the country of New Zealand are the only countries in the world that allow direct-to-consumer marketing. And what that means is that we, as a society, have been led to believe that there's a pill, a silver bullet, for anything that ails us. And so when that becomes part of our consciousness, all of a sudden we're in a situation where there is just a flood of prescription drugs. And as Ms. Vale was saying earlier, that flood of prescription drugs ebbs and flows based upon a person's ability to be able to purchase. And when you get to the point where the physician has said to you, I'm no longer writing a prescription to you for hydrocodone or Vicodin or Lortabs or Percocet or whatever the case might be, that person turns to the street. And the people that smuggle drugs from Mexico or South Central America or wherever they're coming from at a particular time, no marketing. Let's get the kids the stuff that they're going to think is okay, because it's cheap and it's readily available. And one of the things that has happened too over time is the purity level of heroin has increased. And so it's gone from purity of about 7% in the 1960s to about 70% now. What that means in practical terms for the novice user is they don't have to take something that's 7% and inject it. That would be abhorrent to them. But what they can do with something that is 70% pure or 100% pure is they could smoke it, they could snort it, it can be readily available to them in a manner that is more genteel to their palate. And once they become used to having that drug in their system, it's a short trip for them to start injecting it.
Some people, go ahead.
I was just going to add, so, it's a combination of access to prescription narcotics and improper disposal or lack of disposal of prescription narcotics. So a lot of these individuals, frequently kids, are getting access to prescription narcotics from your own medicine
5
cabinets.
years ago. Well, I guess I don't
it was
understand.
going on from, and I was going to lead to that.
Okay.
So then you've got the increased, purity levels of the heroin, and you've just got more and more people getting addicted. One of the things we noted, as Judge Allen said when he had his previous job, when we were in Kalamazoo County and dealing with a heroin issue in one of our communities, is that we reside on a corridor between Detroit and Chicago, I-94. And similarly, Lansing resides on a corridor. So, you find some issues with, communities related to, the access of drugs moving back and forth on those corridors and things like that create some trends.
All right, Todd.
I wanted to point out that during this press conference, you noted that the age of people who were dying from overdoses was mid-40s. Is that right?
That is correct.
But the ones that were recovering from a Narcan, from getting pushed Narcan, which is the drug that sort of stops an overdose, were much younger. Can you explain why there seems to be that age differential that's going on? Do we know?
Well, I think we can guess in a lot of ways. A lot of the overdoses are happening in folks under the age of 30, the overdoses that don't result in death, whereas the average age of death is, I believe, 47, 46 this year is 43 last year, and predominantly by a slight majority white males. One could assume to some extent that younger people might be a little bit healthier and more robust and able to have their bodies withstand, a significant, push on them more than people do as they get older. So that would be one of the things that I would say is probably creating that difference between who's dying versus who's having these addiction abuse issues and is continuously kind of recovering from them, but not really recovering because they're still addicted.
Both of you, of course, have to work within laws and policies, but there's a bigger picture here, isn't this? I mean, the country is always going to be subject to somebody who's got a cheaper drug. Our country's drug policy needs to be addressed, doesn't it? I mean, we have this war on drugs that doesn't seem to stop these kind of surges or epidemics. What do we need? What do we need to do nationally?
Actually, I heard, and we kind of talked about it a little bit at the press conference, that there is a sort of shifting in the thought process of the powers that be in Washington and other bastions of government, where people are saying, we're spending way too much on corrections and we can't use handcuffs to get our way out of this problem. That this is a situation where we have to do, what we call best practices, and Ms. Vail can speak to best practices a little bit more than I could, but certainly we have to do those things that we know are effective to try and counteract what it is that we see in terms of this epidemic, because this epidemic is sweeping the entire nation, and it's going from state to state, and from county to county, and from neighborhood to neighborhood, and it does not respect any demographic in terms of what it's doing. And so what we have started to see is, because of the sort of impact that it has throughout the community, that more people are willing to talk about and try and figure out a way to address the issue, because now it touches and concerns them as well. It's not in somebody else's backyard, it's in the backyard of the congressman. I mean, I think that Senator Kennedy had many members of his family while he was still around that were touched by various forms of addiction, and so he actually instituted health parity between mental health and substance abuse and primary health care. That conversation started probably about 10 years ago, and it's filtered its way down to state legislatures, and so we're having conversations here in Lansing about what we need to do in order to, like, for example, decriminalize the use and possession of small amounts of narcotics, and to make sure that people are being treated as opposed to being punished, because we know that treatment does in fact work, and just punishing a person for the reasons that I stated earlier is just not going to suffice.
Some countries simply maintain their addictions because it makes more sense than trying to prevent their use. And you have had some very good results in sobriety court, but your own numbers indicate you've got a 9% recidivism rate, which is far below the national average, but still it's nearly a tenth of the people who go through your program. And then you've got 20% of the people who enter it who never get through the program. So we're looking at close to 30% in your court's experience who simply aren't being helped.
Well, they're being helped, but I think that it's difficult to say how much you can quantify it, because we're actually at the end of the day talking about preventing something.
Mm-hmm.
How do you quantify when something has been avoided? It's kind of hard to do.
Mm-hmm.
And so what we do is we try and, as Ms. Vale says, you look at epidemiological factors to try and determine what it is that you're actually dealing with. But what I would say to you is kind of like that little analogy about the starfish. Little kid on the beach, and he's throwing back starfishes, and the guy comes by and he says, well, while you're doing that, you're going to be able to save all of these starfishes. He says, well, I'm going to pick up and throw this one back in the ocean, and it's going to make a difference to this one.
This is just what President Obama just said about gun control.
Yeah.
You're not going to stop all the violence, but you might stop one person from getting killed.
And that's important.
Well, and I think the whole philosophy around maintaining the addiction, and that has some, I guess that has some logic to it. But on the other hand, I mean, you think about the life of somebody who's addicted. So you're maintaining somebody who's in a constant state of craving. I mean, all they can think about is that drug. So their life, their family life, all of those things are so jeopardized by that approach rather than trying to get people into recovery. So.
Look, at the end of the day, we know that prevention is going to be the better option, right? But we heard in this press conference today that K-12 is sort of falling down on the job. Do we need to have a concerted effort in addressing the K-12 system and making sure that that Michigan model, which is evidence-based, is implemented in every school district? Is that part of the problem? And I'll throw that to both of you.
Well, part of the problem, I think, is just inertia, that you've got to get people to rally around the fact of what the information shows you. That people get so used to doing what it is that they do that they're not bad people. They're not ignoring what's going on. They just may not be aware of the opportunities to kind of step outside of the silo that they find themselves in, and to be able to say, okay, we need a united front to try and address what this issue is. And if we come together out of our silos, there's actually synergy that is created that we will be able to, and that's not to say that we're going to 100% eradicate the problem, but certainly we'll be in a position to be much more effective across the board if all of the players, all of the folks that have an interest in the recovery of our community are at the table and collaborating and working in unison together. It's certainly going to prevent most of what it is that we're seeing. Again, it's hard to quantify numbers. I guess you can do, death reports and say, okay, well, we had so many people die in 2015, and now that number has been reduced in 2016. But, for me, I'd like to see a situation where we're just doing what it is that we know we're supposed to do, and then we kind of let things go from there.
I'll just follow up on that. You ended the question with, is that part of the problem? Whether it's part of the problem or not is hard to identify. It's absent, so, there are things that you can identify that are contributing to the problem, absence of something, But I would say that the Michigan model and the curriculum that is available to be implemented is certainly part of the solution.
Well, let's talk about other parts of the solution, because one of the positive notes from the press conference that you put together was there are a lot of resources available. So if someone is addicted, or if someone in their family is addicted, what should they do?
Well, they again, Judge Allen has pointed out any number of times, first of all, the individual that's addicted has got to be ready. And there is a window of opportunity on that sometimes can be quite small. So first you have to have somebody ready. Families who are dealing with it without somebody that are ready, I would recommend they talk to Families Against Narcotics, because then they can get some support around what they are dealing with.
This is the Phil Pavona's group.
And Judge Allen is also involved with Families Against Narcotics, because dealing with a child that's addicted is a very confusing thing as a parent. And there's a lot of behaviors that go on that throw you for a lot of loops. There's a lot of, lying and manipulating and things like that Families Against Narcotics can help say, yeah, that's normal, and this is what's going to happen next, and that was probably a lie, and this is why, and your kid's just manipulating you, and you need to stop, and those sorts of things. So that's a real good resource for that. For somebody who's looking to get in, for somebody who's at that step where they're ready to get into recovery, Community Mental Health's assist line is a good place to start. There are some other resources in the community. You may know more of those than I do. That we do have a number of resources in the community to get people into treatment and recovery. But they do need to know where to call.
Where do they start, though? Do they call the Ingham County Health Department?
Clinton, Eaton, Ingham County Community Mental Health.
Okay. And apparently another way to do it, it sounds like, is simply to call the Lansing Police Department, because the Police Chief Yankowski has said, we're not out to arrest people for this, we're out to get them help.
Right, and I know that their officers are carrying around information related to some other recovery centers, treatment facilities that are in town that they can help facilitate getting people into as well. And you probably know about the...
Well, there's 211 too, so
Right.
people can call 211 and get
What
information.
is 211?
It's a basic information line, kind of like calling information was 411 or calling for emergency services at 911. Now there's a 211 where you can actually call in and get information.
It's about
helpful.
connecting to human services, social services, kinds of agencies through town that provide a lot of these kinds of options, programs, treatments.
And
So-
do we have adequate support for people who want help? I mean, if somebody called you today, would they, within a day or two, be getting help?
We do have. I mean, our public system run through Community Mental Health has got availability and is ready to help.
All right.
They're not beyond their limits, and yeah.
Great. Well, we're about out of time. Linda Vale, Ingham County Health Officer, Judge Donald Allen from 55th District Court, who oversees the Sobriety Court. Thank you both for being here. Todd, thank you for being here.
you.
Folks, if you need help, you can call the health department, you can call the police, you can check out Families Against Narcotics online. Thanks for tuning in this morning. We'll see you again next week.
Thank you.